ChatGPT Health. What it really is, what it does, and what it does not do. In early 2026, OpenAI released something called ChatGPT Health. Many people immediately assumed it was a medical AI, or even a digital doctor. It is not. And that misunderstanding is exactly why this matters. Understanding what it actually is, and what it is not, is far more important than most people realize. Why this matters. Before ChatGPT Health even existed, millions of people around the world were already using general-purpose AI models to ask deeply personal health questions. They were interpreting diagnoses, reading lab results, researching medications, and deciding whether to seek medical care, often without any direct clinical guidance. This behavior did not begin with ChatGPT Health. It emerged organically as people searched for clarity in a healthcare system that is often complex, fragmented, and difficult to navigate. ChatGPT Health was launched as a response to that reality, not as a replacement for medicine, but as an attempt to introduce structure, limits, and safety into an already existing pattern of use. So, what exactly is ChatGPT Health? ChatGPT Health is a vertical, specialized experience within the ChatGPT ecosystem, intentionally designed for conversations related to health and well-being. It operates separately from the general chat environment, with additional safeguards applied specifically because of the sensitivity of health-related information. It is not a standalone application, and it is not a clinically certified medical software approved by health authorities. This distinction is critical. ChatGPT Health does not fall under the category of medical devices, diagnostic systems, or treatment platforms. Instead, it is a specialized conversational interface governed by stricter safety and privacy rules, as defined in OpenAI's official documentation. These rules exist because health information carries higher risks if misunderstood, misused, or taken out of context. This means ChatGPT Health is not telemedicine. It does not connect users to licensed clinicians. It does not review medical images, prescribe drugs, or authorize treatment decisions. Rather, it functions as an informational layer, designed to help people understand health-related information more clearly, without making clinical decisions on their behalf. According to OpenAI, several core characteristics define this experience. First, health-related conversations are logically isolated from general chat threads. This separation reduces the risk of contextual leakage and limits unintended reuse of sensitive information. Second, data entered in this mode is not used to train general-purpose models. This policy exists to protect user privacy and prevent health conversations from influencing unrelated AI behavior. Third, additional safeguards activate automatically when topics such as disease, medication, chronic illness, or mental health are detected. These safeguards constrain how the system responds and prioritize caution over completeness. OpenAI states explicitly that ChatGPT Health does not diagnose conditions, does not prescribe medical treatments, and does not replace a healthcare professional. What people use it for. So what can ChatGPT Health actually do today? Based strictly on official documentation and independent academic analysis, its role is informational and organizational, not clinical. First, medical education and comprehension. ChatGPT Health can explain diagnoses that have already been provided by a licensed healthcare professional. It can translate complex medical terminology into plain language, clarify unfamiliar terms, and explain why certain tests or procedures may have been ordered, without evaluating, confirming, or modifying the diagnosis itself. Second, general information about medications. The system can provide high-level information on common uses of medications, general safety warnings, and frequently reported side effects described in medical literature. Importantly, it does this without personalization, without assessing contraindications, and without offering dosage recommendations. Third, organization of health information. ChatGPT Health can summarize health-related information voluntarily provided by the user, such as visit notes, discharge summaries, or lab descriptions. It can help users identify patterns, highlight key points, and prepare structured questions for an upcoming medical appointment. This use case is particularly important in real-world settings, where clinical visits are often time-limited and patients struggle to articulate concerns under pressure. Fourth, general wellness information. The system can provide educational information about sleep hygiene, physical activity, stress management, and general nutrition principles. These responses remain strictly informational and intentionally avoid generating individualized, therapeutic, dietary, or treatment plans. All of these uses are explicitly permitted by OpenAI and are consistently described by external academic sources as supportive functions, designed to inform, not decide. What ChatGPT Health cannot do. This section is critical. ChatGPT Health cannot diagnose diseases, cannot evaluate whether a medication dose is correct for a specific person, cannot recommend treatments as a first line of care, and cannot interpret symptoms to make clinical or emergency decisions. Medical experts repeatedly emphasize that the primary risk of health-focused AI tools is not the technology itself, but user overconfidence. The danger arises when people mistake a coherent explanation for a medical diagnosis or treat informational content as professional judgment. For this reason, OpenAI documents that the system introduces warnings, constrains responses, and actively encourages consultation with qualified healthcare professionals whenever conversations approach decision-critical medical territory. So, what about the regulation, the debate, and the criticism? The launch of ChatGPT Health has not been universally celebrated, and its reception has varied significantly across regions, regulatory bodies, and professional communities within healthcare. In countries such as Australia, regulators and public health experts have raised concerns about the potential misuse of health-focused AI tools by vulnerable populations. These concerns are not centered on the existence of the technology itself, but on the context in which it is used, particularly when users lack medical literacy or access to professional guidance. A recurring regulatory concern is that tools like ChatGPT Health operate in a gray zone. They are not classified as medical devices, yet they engage with medical information that can influence real-world health decisions. This raises unresolved questions about responsibility, liability, and the boundaries between education and care. From the clinical sector, skepticism is often more structural than technological. Many physicians and healthcare organizations argue that AI systems handling health information should remain embedded within formal healthcare infrastructures, such as electronic health records, hospital portals, or clinician-supervised platforms, rather than operating as direct-to-consumer tools. Their concern is that when health AI exists outside clinical workflows, it may fragment care rather than support it. Information may be interpreted without full medical context, and important nuances, such as comorbidities, longitudinal history, or social determinants of health, may be absent. Others in the clinical community acknowledge potential benefits, but emphasize strict role separation. In this view, AI can assist with preparation, comprehension, and organization, but must never become a perceived authority or decision-maker in the clinical relationship. From academia, the discussion is more measured. Universities and research institutions broadly agree that systems like ChatGPT Health can provide meaningful educational value at scale. They highlight its potential to reduce information asymmetry, improve patient preparedness, and increase engagement with healthcare systems. However, academic consensus also stresses that this value is conditional. The effectiveness and safety of such tools depend heavily on user understanding. When users clearly recognize that the system is informational, not diagnostic, the risk profile is significantly reduced. When they do not, the risks increase sharply. As a result, many researchers emphasize that the future impact of ChatGPT Health will be shaped less by model performance alone, and more by interface design, user education, and the clarity of communicated limitations. Our conclusion and takeaway for you. Based strictly on documented evidence available in January 2026, ChatGPT Health is not a doctor. It does not practice medicine, and it does not exercise clinical judgment. What it represents instead is a new layer in how people access, organize, and understand health-related information, particularly in systems where medical language is complex, fragmented, and often inaccessible. Its value lies in education, clarification, and information organization. Its risk lies in misinterpretation, overconfidence, and misuse outside proper clinical contexts. These risks are not fixed flaws. They are design challenges, and history shows that AI systems tend to improve over time by reducing harm, not increasing it. And that tension between expanded access to information and the necessity of firm clinical boundaries is what ultimately defines artificial intelligence in healthcare in the years ahead.